This is Dr. Caudill Miller with Dr. Miller's Guide to Neurology, and today we're going to talk about intracerebral aneurysms. You know, an aneurysm is a little bubble on the side of a blood vessel. It's a cerebral vascular disorder in which there's a weakness in the wall of a cerebral artery or vein and causes a localized dilatation or bubble or ballooning of the blood vessel. Aneurysms, you're generally born with them, and if they don't rupture, you can live with them a very, very long time. Aneurysms, they're in the posterior circulation in the back of your brain. They're much more likely to rupture. Aneurysms, the posterior communicating artery, much more likely to rupture. They're classified by size. You know, small is less than 15 millimeters, large is 15 to 25 millimeters, and giant is greater than 50 millimeters. Saccular aneurysms or Berry aneurysms are round, and the most common form of aneurysm. They tend to occur in the anterior communicating or posterior communicating artery, the middle cerebral, the internal carotid, and the tip of the basilar. Fusiform or a wide aneurysm, a wide segment of an entire vessel rather than just one side. They usually do not rupture. They can, but they usually do not. Microaneurysms are very small, less than 300 micrometers, and they're the lenticulostriate vessels of the basal ganglia associated with chronic hypertension, and they're a very common cause of intracerebral hemorrhage. So what's the symptoms? Someone comes in our office and they have a thunderclap headache, the worst headache of my life. They have an aneurysm until proven otherwise. They need an emergent CT because you'll see blood better on CT than MRI and a lumbar puncture. It can be a severe headache with nausea and vomiting, confusion, drowsy, even loss of consciousness. They can have meningism where their neck is stiff. So they bend forward and they have stiff neck or pain shooting down from their neck. They can have vasospasm for the aneurysm, you know, up to 21 days after the hemorrhage that can cause a stroke. The risk factors are, you know, the usual risk factors. It can be congenital, be born with it, hypertension, smoking, alcoholism, obesity. So the treatment is really emergent, surgical clipping or endovascular coiling. The coil is like a cardiac stent. You enter it in the groin in the femoral artery, and the coil is pushed into the aneurysm, expands it, initiates a thrombus or a clot in the aneurysm. And almost like, you know, the stents pass first into the parent artery and almost like a scaffold sort of to hold it together, and then the coil is placed in there. Very small aneurysms have low risk of hemorrhaging. You know, medications, you know, phenytoin is used to treat the vasospasm. We use seizure drugs, anticonvulsants for vasospasm. Everybody's loaded with Cerebrex and later changed to something else. Many are given Keppra IV. Can use Depakote, Lamictal, really any anticonvulsants you want. Neurologists aren't real big about keeping people on anticonvulsants for very long unless they've had a seizure. You know, 50% of people that have a structural lesion that, you know, will never get a seizure. 50% of people that have a structural lesion will. So neurologists aren't real big about treating, you know, prevention for seizures if they've not already had one. So that's aneurysm. So like my channel, subscribe to my channel, make any comments, and if you have any other topics you want me to discuss, you know, I'm posting videos every week. We can put something first. But aneurysm is very important, and more later.